I'm Dr Maryhan. I'm a child psychologist and I specialise in work with children, teenagers and adults that might be experiencing what I call big emotions. So they may be dealing with a particularly difficult situation, they may be somebody who's particularly anxious, or they're worrying, or they find themselves in a situation that they don't necessarily want to be and they need support to move from where they are to where they want to be. It's really important when you have those situations that you prepare them with as much information as you possibly can so that they understand what's going to happen, the process that's going to happen, and be really honest about where there may be some discomfort. And it's the suddenness, let's say, of the tilt test. It's about explaining to them all of the procedures as best as you can, where they're likely to experience some discomfort, and really be honest and acknowledge that they may well find it difficult, they might find it challenging, they may feel anxious, they may worry about it, and then encourage them to ask you questions and then have a real honest discussion with them about what they might need to take with them and what they might need to do to help themselves when they feel particularly anxious. So it's having conversations about who they might want with them at the time. Do they need to maybe bring something like a comforter or something that helps them in those particular situations? I mean, those are the sorts of things that you want to do. And then what you might also do is teach them a really simple breathing technique that might help them relax in those situations. And the more you practice that breathing technique and the relaxation technique before it happens, the better equipped they are. Because then when they're feeling a bit anxious and worried or disorientated or distressed, you can then remind them to use the technique that they've practiced. I've got two that I would recommend. One is called the 7-11, and the premise behind it is that you take a deep inhale through your nose to the count of 7, and then the exhale is a slower, longer exhale to the count of 11. Now, in my experience, it can be really tricky to count and breathe in and out at the same time. So the premise of it is just that the exhale should be significantly longer than the inhale. So they don't need to get caught up or worried about counting. The other technique that I would recommend, and this is easier because it doesn't require them to alter the breath and it serves as a really good distraction. So this is one of my most favourite, is the take 10. And what you do is you simply count your breath, but you only count your breath up to 10. So the first inhale, you mentally count 1. Then when you exhale out, you're counting, I've got to number 2 now. The next inhale in is a count of 3. Next exhale out is 4. In 5, all the way to 10. And then you just start again. 1 to 10. And you can do it as often or as long as you need. In my experience, doing the take 10 3 times is the most effective, because the first 10, they're slightly awkward with it, they're not quite sure what they're doing. The second 10, they begin to get into a rhythm. By the third 10, they're getting super relaxed. And that's a really great one to get them to practice before they go to bed.